Alongside the economy and illegal immigration, surely this government's other great priority is the NHS. It's a scandal that over 7 million people are on a waiting list for treatment. What's that? Almost 1 in 10 of the population. We know the issues, the pandemic, and, as I've mentioned before, dreadful levels of public health in this country. So, for example, obesity and other lifestyle-related illnesses are bringing the service to its knees, threatening to ultimately bankrupt it. But the prescription is clear: an unprecedented focus on public health through education, encourage the public, starting with kids at school, to adopt a healthy diet, maybe teach kids how to cook at school. And the NHS can be liberated from what it currently does, which is essentially to facilitate and underwrite our unhealthy lifestyles. In its management of COVID, the NHS was clearly trying to save lives, and they feared becoming overwhelmed. I understand. But in my view, it was a disastrous policy in which so much focus on one disease came at the expense of more serious illnesses like cancer, mental health, type 2 diabetes and dementia. With excess deaths in early January of this year, the highest since February 2021 at the height of the pandemic, it doesn't speak well for the government's lockdown policy or even the vaccine rollout, after both of which you would expect excess deaths to be below, not above average. Wasn't that the point? So the NHS must change or die, which is why I'm pleased to see that at last we're having a grown-up national conversation about the service. It's very clear that the nurses and doctors, the hospital porters, the cooks, the security guards, you name it, they are the best we have. We love them. And the doctors and nurses have been through hell during the pandemic. But at a cost of £13,000 per household, the NHS's problems are no longer about cash. Most of the public accept this money pit can no longer be filled, and change is the answer. Notwithstanding a government injection of more billions over the next 2 years to catch up from the pandemic, this money will rightly be combined with real reform and fresh ideas. For example, as reported in today's Sunday Telegraph, the idea of opening more so-called virtual wards so the frail and elderly can be monitored at home by doctors using video and other technology. Now, don't worry, they won't be stuck at home with an iPad or an iPhone. They may not have one. Importantly, this will work with the backup of community teams visiting people in their homes, taking pressure off hospitals and improving patient care. So there you go. The doctor will see you now, at home. What's not to like? We can debate the rights and wrongs of these ideas, but it's clear the system we have at the moment is not working. Drastic changes are needed to save the patient. I think we should start by scrapping diversity officers and middle managers on 6-figure salaries. The NHS needs to be leaner, meaner and, yes, smaller. It's often proudly said that the NHS is the biggest employer in Europe, apparently the 3rd biggest employer in the world. Why is that a boast? That is a shameful admission of its wild inefficiency. Be clear, I don't want to see the NHS privatised, and I do not want an American system in which you have to reach for your credit card when you break your leg. Absolutely not. But it's good that we're having a conversation about how private enterprise can be deployed to save costs and to deliver a better service for patients. Even Labour are saying that now. It's good that we're having a conversation about possibly charging for GP appointments, which could potentially prevent missed appointments and stop so many people taking our so-called free health service for granted. Maybe it's a bad policy, maybe it's a good one, but let's talk about it, let's debate it. A day of reckoning is coming for our health service if it is to survive. The NHS is no longer a political sacred cow. Yes, the staff are utterly brilliant, but its middle managers are full of bull. The health service has been milking us for too long, and given the NHS has presided over decades of declining public health, I've got beef with it. The stakes are high, so they must take stock and go hell for leather. If we don't embrace change, we risk déjà vu. The NHS sacred cow has become a mad cow, but it's too soon for the slaughterhouse just yet.